Hello, everyone, and welcome to our Latin American Chamber of Commerce Charlotte Mid-Year Conference 2020. My name is Rich Robles, and I am the Senior Director of Diversity, Inclusion, and Equity at Novan Health. I also get to have a role in the Latin American Chamber of Commerce Charlotte. I'm part of the board, and I get to have really, build relationships with our community, as well as get to talk to leaders who are making a difference in our communities, not just for the Latino community, but also for the entire city of Charlotte. So this morning, I'm also joined by my colleague Lina, and Lina, I want to turn it over to you for an introduction.
Hello, Rich. Thank you so much. My name is Lina Varela Gonzalez, and I am the Director of Nursing in the Emergency Department at Novant Health Presbyterian Medical Center. And it's an honor for me to be here today to talk to this community about what we have been working with in Novant Health and just having the opportunity to connect with you.
All right, thank you, Lina. And I'm so excited to be having this discussion with you. So I want to get into we're going to be doing some questions and talk about what we have been experiencing and seeing. So my first question for you is, what has that been like for you in the last 3 to 4 months and everything that has transpired for us?
Wow, Rich, that's a loaded question. I'm just being able to sit back and think through what we've been through in the last 3 to 4 months. The pandemic has been a life-changing event for everyone, not just within Novant Health, but also within our communities. We have been managing some fear, some uncertainty, but also a lot of heroic and courageous work. Working through the pandemic, we have learned that we need to be agile and that our normal day-to-day work is no longer normal, and that we must shift to be able to care and work through the pandemic in an environment that is unknown to us. And that has been successful to us due to the team effort and our core value of courage, and being able to say, this is hard, and we have some fear, but we're also going to be able to continue to move forward. And how we move forward is just shifting our mindset and being open to new practices and challenging new practices that we probably have not done before, or that we have done before and just had to work through some regulatory components. So that's how we have been able to manage and work through the pandemic. I think the other important thing about this is not losing focus on what's more important. And what really is important is our people. We are in healthcare to take care of our community, so it is our purpose. And that's how we have been able to lead in our business, by focusing on what really matters, and that is our patients and our team members.
So Lina, thank you. And like you said, and what really matters, our patients and our team members. You spoke a little bit about the heroic acts and the heroic pieces that you have seen throughout this. Any ones that you care to mention where you have seen someone step out and exercise courage and help our patients and team members?
Wow, Rich, there's so many of them that though I could take this entire time to just share names of our team. Not only is it our team members that are showing heroic work and our leaders within our organization, but our community. To me as a nurse and as a leader within the healthcare, it has been extremely rewarding to see how the community has come together to support one another. We've had several donations around foods, masks, and what can we do to combine the supports in caring for our community. It's been, I think that's what's been the most heroic. We typically don't see those efforts, and our community and our patients and our team members have really stood out out in stepping outside their normal day-to-day efforts to care for one another.
Thank you, Lina. And you're right, as we, are being part of a system, Novan Health, and how we have been exercising our core values of courage, compassion, and also diversity and inclusion. Can you talk a little bit more about that inclusion part around how we have been taking care of our patients and having conversations with our team members?
Diversity and inclusion is one of our core values, and we have done an enormous work around making sure that we are connecting to communities of lower resources. And by that, I mean we have focused on having screening centers, in communities where we know we have a disproportion of healthcare and resources, and to be able to not only screen our patients, but educate our patients and our family members within our community to be able to safely care for themselves and each other. We've provided our community with masks throughout this pandemic, as we know that we had a lacking of sources of masks for a while. So as an organization, going back to what our purpose is of caring for our patients and our community, we're going out there to provide our community with the resources that we need to keep ourselves safe.
Yeah. Yeah, Lina, you're talking about, the screenings and what our team members have been doing for our patients and our community. What have you had to shift in our emergency department to keep everyone safe? And by everyone, we mean our patients, our team members, and people in the community and family members who come in contact with our hospital.
Emergency medicine, nursing is in my blood. That it drives my adrenaline, and that's one of the reasons why I went into nursing. And one of the things that we've had to shift is be the calm to the fear. We have seen many of our patients come in and family members extremely fearful of getting sick or hurting our patients or hurting other patients or hurting our team members. So we've had to be that voice of calm, that voice of education, that voice of setting reality versus all the news that goes on there, and then being that resource to our teams. There's many times that I did not know the answer of what was next or how we were going to shift our workflows around caring for a patient, and just being honest with our team members and including them in the decision making has made this team stronger, not only for our team, but for our community and how we've shifted within the organization.
All right. So Lina, talking about the last piece of shifting the organization, what do you see in the foreseeable future? Where does our organization need to change to be able to continue thriving in the middle of a pandemic, but also what's after COVID-19?
Rich, I think quarantine people in their homes have probably shifted the way that we deliver care to our patients in our communities. And we have probably shifted to providing telehealth permanently to our patients and communities. Prior to the pandemic, we had a lower rate of using telehealth or telemedicine for our community, and now it's the norm. We're seeing patients and family members connecting on a daily basis with our physicians and our healthcare team, from basic well visits to a thorough examination. So I think we are probably shifting to using more technology in how we deliver and connect with our patients day to day. And I think the other thing that we're seeing within our healthcare system is the shift on some of the regulatory barriers that we had prior to the pandemic associated with technology and healthcare. So I think that is shifting within our healthcare system.
All right. So Lina, something that we talk about within our organization in helping our organization shift is the resilience and the courage and the compassion that we need to have as leaders. What has helped you stay resilient and navigate these unprecedented times that we're all experiencing?
Rich, it's the purpose. Nurses, doctors, healthcare leaders go into healthcare because our purpose is to care for our community. We want to make sure that we improve the healthcare of our patients. And being in a pandemic, this is what drives healthcare. This is the purpose behind it. And being able to be there when our community and every family needs us the most to practice nursing and medicine and help someone get better, that is the driver to keeping me resilient and just grounding me in my purpose. The other thing is the team that we have within the emergency department and within Novant Health. It has been amazing to see the team effort and the compassion and collaboration that we've had within every aspect of the healthcare system, from material services, from finances, nursing, technology. We are one team that has been pushing forward to stay healthy and help our community stay healthy.
Thank you, Lina. I like that piece, how we help our community stay healthy. So I would like to end with this, general question around what words of wisdom would you have for our community? Not only as our leader in our emergency services, but also as Lina Varela Gonzalez. What would be that nugget of wisdom that you would share with us?
So I have a couple, if you allow me to share it with you.
Let's go.
First of all is we gotta keep hand washing. We gotta wash our hands to stay healthy, to help our loved ones stay healthy. The second one is we need to follow the directions that we get around masking and social distancing. This is how we're going to care for each other. But lastly, Rich, my mother always told me, you got to treat everyone with kindness and love. And I tell you that regardless of the type of pandemic that we have, we should never forget to be kind to ourselves, first of all, and to be kind to others. And I think with kindness and love, we can lead through very challenging times. And that's what this year is going to be. This year has challenges, and it will continue to be challenging, but we need to push forward with kindness and caring for one another.
Thank you, Lina. I just can't think of a better way of ending this conversation as a reminder for all of us to be kind to one another and to be kind to ourselves. So thank you everyone for joining today's conversation that we had with Lina. We appreciate all of you being here, and thank you.
Thank you, Rich. Thank you, everyone. Have a great one.